Very much for staying with us here on Focus on Health. If you're joining us right now, we've been talking about ear, nose and throat, and to be more precise, we're talking about the ear. And of course, if we go deeper into that, we're talking about otitis media. Thank you very much, Dr. for staying with us. How is it so far? Just talking about all these. What is when I ask you this? I'm asking. I mean that which is one of the most severe ear condition that you've been able to handle in your medical life?
I would say there are quite a number of medical conditions affecting the ear.
Yes.
And otitis media, which we're discussing today, is one of the very most common that will come to the hospital.
Yeah, and of course statistics are showing that this is one of the most common infections affecting children below 5 years, with the World Health Organization saying that it affects 11% of people each year. That is around 709 million cases. Yeah, so why is that a cause? Is that a call for alarm?
It is a call for alarm because of the complication which we talked about earlier. And especially in our children. So it means that as parents, we need to be keen on what is happening around our children.
Yes.
And we talked about breastfeeding and exclusive breastfeeding for the first 6 months.
Yes.
Because it becomes a challenge for most of our mothers. Because for those who are working, you have maybe 3 months for maternity leave and you won't go back to work. So at this point now you want to introduce other foods to this baby, or else win this baby at this early age.
Yes.
And it interferes with the immunity development system of this baby. So it becomes a risk factor because you're predisposing this child to low immunity at early age. So one of the things, because of the high prevalence of this condition, we encourage our mothers is, as much as we can, let's practice exclusive breastfeeding for the first 6 months.
Yeah.
Again, it's common, and especially in our towns, taking your babies to daycare.
Yes.
And the environment is not so good for our children. If we can, we try to avoid daycare as much as we can. As much as sometimes it's not avoidable, but it's unadvisable.
Yeah. But of course, just diverting a little bit, we know how hard the economic situation is. Telling somebody to stay at home so that they can be able to take care of their children while they also need to fend for the same children is close to inevitable. Do you think that we can maybe look for other ways of maybe trying to cover this up?
One, you find that most of our daycare currently are in our living places, whereby you find a small room is almost occupied by 50 children or even more. So we understand, yes, we're living in difficult economic times. And don't just be too quick to take your baby to a daycare. It is important, just the way you choose a school for your child, it is also important you choose the daycare where you're taking your baby. Again, when you're coming home, how are you able to spend some time with this child, understand how this child was, and being able to capture even the slightest change in this body, in the child's body? Because most of the time that we come home, we're tired, and we leave our babies to our house girls, or as our house managers. And they're the only people who know about our children. Actually, to an extent whereby our children will call them their moms and forget their real moms.
Yeah. So coming back to our discussion now, talking about otitis media. So we have different types of otitis media. Would you please break down for us and at what point does it transition from being this type to the next?
In otitis media, we have one is acute otitis media.
Yes.
And when you talk about acute, it means something of sudden onset.
Yeah.
In the morning you wake up and you're okay, and by evening you're not okay. That is what we call acute. So when you talk about acute, one, you'll notice the temperature change. The baby will have high temperatures. The baby will complain of the pain. And in acute otitis media, sometimes it can be self-limiting.
When you say self-limiting, yeah, that was my next question.
Yeah, what do I mean by self-limiting?
Yes, take it away.
Even without treatment, it can resolve on its own, depending on the cause. A child will present and they will have pain, or else they will have, basically it's the pain and then it resolves in less than 48 hours. But if a child has pain and discharged for more than 48 hours, and the temperature is about around above 39 degrees. This is a point whereby we need to seek medical attention.
Yeah.
That is basically about the acute otitis media. When we talk about the chronic otitis media, it means that this is something that has been there for some time. It prolongs. And one of the causes is our misuse of medication. We find that most of the time, when you have a cough or any condition, we are quick to buy over-counter treatment, and especially for antibiotics.
Yes.
So you develop resistance to antibiotics, and especially the very common ones in our market. So you find this child presents with PAS, and because it's a common culture in our nation, you want to go and buy some antibiotics, give this child. In the long run, you find you give antibiotic care, the condition does not resolve. You buy a different one, it doesn't resolve. So you predispose this child to resistance. And with resistance, this child will have this type of condition for almost more than 2 weeks. And at this point, this becomes a chronic otitis media.
And that calls also for the people who are involved in this to maybe regulate the market in terms of controlling the over-the-counter drugs, especially antibiotics. What do you think about that?
What we have in the current Pharmacy and Poison Board,
Yeah.
the instruction is we are not supposed to sell antibiotic without a prescription. But again, because
It's a business.
we are in business. Yeah, because we're in business.
So sad.
And
It's a
again,
sad
if you
reality.
come to my pharmacy or as my chemist and you're a friend,
Yeah.
I'll still quickly dispense. So you find, yes, the regulations are there, but we are not following these instructions.
And also we personally, I've had situations whereby I have something which is really itching my ears, and then you take a sharp object and maybe try and do that. How dangerous is this, and could that also be something that leads to whatever we're discussing tonight?
One, our markets are full of what we call the cotton buds.
Yes.
And we use all sorts of things to soothe the itchiness of our ears.
Yeah.
But again, one of the things we need to understand is that our ears are self-cleansing. And when there's a problem, that is the only time you need to seek medical advice. And especially when the wax is impacted. Or else now, like, you find that you have like tinkling in your ear. You feel like there's a sound that is coming out of your ear. It is very risky to put objects in your ears, because one, there's risk of they will be left inside there. What happens? They're left inside there, and especially for children. Let's talk about the cotton bud, which you use almost every day. If it's left inside, sometimes the initial days you may not have any symptoms, but slowly you'll have ear infection. So it becomes also a risk infection. If you use a sharp object, you risk injury to the ear also. And sometimes you can injure the eardrum because of the sharp objects. Yeah.
So thank you very much for the clarification, but now talking about the treatment. So when you already have otitis media, what is the way out for you? Do we have medical and non-medical treatment for these?
When we talk about otitis media, in terms of treatment, one is the warm compression, at least to soothe the pain, basically.
What do you mean when you say warm compression?
Warm compression means just use a room temperature cloth that is soaked in water and place it on the ear. At least it helps relieve the pain. We have the pain management. In the pain management, you're using pain relievers, which are definitely either over-counter or prescribed.
Yes.
And we have the antibiotic treatment. Antibiotic treatment comes into play with temperature of above 38 degrees Celsius, and also when there's discharge. When there's discharge, there's also a way where we do the ear wick. You remove the pus, then you can use eardrops, or you can use what we call systemic antibiotics. By systemic antibiotic, we mean that you can be given antibiotics to take orally, or depending on the severity of the condition, you're given these antibiotics via the vein, that is the intravenous, or via the intramuscular treatment.
Yeah. And when this is happening at home, do we have any home remedy before one rushes to the hospital?
The only home remedy we'll have here, for example, as it's advised, is one, you can manage the pain and the eye temperatures at home. One, if the baby is presenting with high temperatures, expose this baby. Number two, you can use what you call the warm compression that we've talked about.
Yes.
Because the high temperatures, other than the otitis media, can lead to convulsions because of high temperatures. So expose the baby as you plan to go to the hospital as much as you can, and also use the warm compression to lower the temperatures.
Yeah. So how fast should somebody, when we've really talked about the risk, the signs and symptoms, how fast should one get to the hospital before it becomes severe, like before it leads to other complications that we did talk about, like hear loss, losing the hearing loss, and also the sound not diminishing? How fast should one go to should one access the doctor before all this?
When you talk about infection, it is growing. So the more you delay, the more you risk the complications. The faster you manage to get to the hospital, the better, and the better for you to reduce the risk of complications. So the faster you can get to the hospital, the better for you. Because the challenge with home remedy, we may not understand what is actually this child or this person ailing from. And you may think we are treating condition A and it's condition B.
Yeah.
So the best is seek medical advice.
Thank you. And finally, when all is said and done, we need to talk about prevention. What is the prevention for all this? Because something which has a cause must have a prevention. And when you talk about prevention, we all know about all this. So what would you advise somebody back at home there? How can he or she prevent this from happening?
When we talk about prevention, one of the things we need to do is manage the cold and flu as soon as they occur. So it's important that if you have a cold or a flu, seek medical advice, or else get what we call antihistamine in medical terminologies.
Yes.
So that because it's a risk factor. Again, what we talked about for babies, exclusive breastfeeding, and especially after weaning, try and get a balanced diet. When we talk about balanced diet, it's not about now the economy. It is we have foods that are locally available and at affordable prices.
Yes.
What we need to do is to understand the diet that is a balanced diet for our children. Again, what we need to do is avoid putting things on your ears. It's very important because you don't know what you're doing to your ear. You don't know at what point you may injure your ear. So these are key things we need to look out into. If we can avoid the daycare, also that is a good thing.
Do you think it's Doctor, do you think you came here in the morning and it's almost night? Do you think that we can be able to avoid this?
If we can't avoid, then let's know where we are taking our babies.
Oh, sure.
Let's know whom we're leaving our babies with.
Yeah.
Because it's not every daycare is a daycare. There are those people who are out to make money. They're in total business. And they don't care what happens to your child as much as you leave them there.
A parting shot, that is your camera. To a parent back at home who is listening to us tonight, tell them one last thing.
Tonight we've been talking about ear conditions, and it's very important to take good care of our ears.
Yeah.
So don't just leave your ears. Once in a while, get a medical checkup. Know what is happening with your ears. It is very important maybe once in a year.
Thank you very much, and that's all we had for you. I don't have anything else to say. Dr. Josephine has made it very clear. I can't make it any clearer than that. That's all we had for you here on Focus on Health. Remember that the end of the program does not mean the end of our talk with you. You can talk to us on our social media platforms, on Facebook, DM us. We will always answer all the questions that you had. Right now, we'll leave you with the Did You Know segment. Till next time, bye-bye.